So we'll give her a referral to an eye specialist, and hopefully, again, they'll reach out to her in her village. Looks good. Looks good.
Generally, you don't take these out because they're good, strong teeth.
Yako? Yako umepimwa? Hii ni yako? Kumbe bado wewe hujapimwa.
Let me know spiritual.
You know, in the military setup, you have the officers and then the commissioned ones and then commissioned ones.
Yeah.
So I'm a registered community health nurse. So I'm a registered community health nurse, commissioned.
Very good.
A practical nurse.
Yeah.
And they're the registered ones.
I'm registered also.
Oh, you are?
Yeah, they gave us some. Yeah, they gave us some.
Hello.
Let the music play on. Feel it gone. Party, lively, fiesta, forever. I'll own every second in this world. I swear I own every second. Together, bound to be together. She took my heart. I don't know how it happened.
My name is Captain Danielle Butler, and I work in international health. I'm a physician assistant, and out here as part of apf-kenya, I'm the medical outreach team lead. APF stands for African Partnership Flight, and we work with building relations with our partner nations. And out here we're working specifically with medical, so we're building our relationship with our Kenyan providers and doctors and staff. So on our first day we saw approximately 300 patients. We saw a lot of children, a lot of illnesses such as colds and flus, some stomach irritation and minor GI problems and things like that. Yes, I believe it's very important for us to be here because as you can see we're pretty remote, and the folks that are in the surrounding area, it's kind of a county, they live very far out, some places that roads don't even go, so they're having to travel to certain points where we can pick them up and bring patients into our camp. So I think it was very important. The patients have been very appreciative of us coming out to pick them up and us being here, working with the local Kenyans and giving them care. So the participants that are out here are from the U.S. We have our Massachusetts Air National Guard. They're working with our state partnership program, so they were able to come out. We brought doctors and dentists, medical technicians, dental technicians. And from the local area, we have the Kenyan Air Force providers. We have some local pharmacists that work for the county health system. We also have some public health. We have lots of nurses and other technicians that have come out. The medical role here in apf-kenya, I believe, has been huge. We've been able to reach out to all the people out here that have no idea about what APF really is. It's just the medical part as far as reaching out, building that relationship, getting people's trust has been huge. We've really had a lot of good response from it. It's really been rewarding for us as well. All of our active duty people have learned so much already in just a couple days, so for us it's been just as rewarding as hopefully what we're providing for them. So some of the things I'm taking away from this is just a greater appreciation, of course, for what we have, what our military has. The Air Force we're very lucky, I think, to what we have and what we're provided. We're realizing how lucky that we are. Some other things that I'm taking away from this is just we can do so much more with less. You know, that's what we're learning, is we don't always need supplies and certain medications. It's just doing basic medical care that's important. So the people in this area have been so appreciative because they don't have, some of them haven't been seen in 7-10 years, maybe not at all. They have trust in us, and I think that's something that's really been eye-opening, that they're coming to us when they've not gone to anybody else. So that's been very rewarding.
Joshua Gates, Joshua-Gates, Master Sergeant, and I am a regional band craftsman in the USAFE band, and here in this role I am the Director of Operations. Right now we are in Lokusero village up in Laikipia County in Kenya, and we are here as part of the Africa Partnership Flight, and the band is combining with the medical outreach that they're doing here to this village, and we're coming to perform some music, make some people happy. Yeah. I think for the United States and Kenya is a very important partner, and we've been working with them for a long time to increase their capabilities, because increasing capabilities of each country will increase the regional security of the whole area. So we're trying to do that, and for us as the USAFE band, our part is that we come in, make things easier. We're like the little bit of a grease in the conversation to get things happening. And an important thing for us as well is not only with these official functions with the APF, that we also are able to partner with our State Department friends here, and we go out into communities and able to do outreach and communicate throughout Kenya. So we're very happy to be able to do that. I think that as music and music and diplomacy kind of go hand in hand, and that we're able to come out to these areas and present a positive message to the people here that live in these communities to continue with their education, continue with making good choices that can result in their input and contribution to their society and to Kenya as a whole. So it's really great for us to be able to come here. As you can, I don't know if you can see in the background, our band is surrounded by children. These youth are going to be the future leaders of this country, and if we can contribute this positive effect to them, it's an amazing thing that we can do. Definitely, I think that presenting a positive message, sharing our American culture and Western culture with the people of Kenya and with these communities, I think is a positive outlook, and it can go down the road where you have this 6-year-old here that remembers, oh, when 10 years ago I was able to hear an American band and I interacted with them, and I know what they're really like, and I know that the positive influence that they have. So that can be something that goes down the road that we see in 10, 15, 20 years, that little bit of positive spin on what we do as Americans and how we are trying to help these communities. To me, the band's role in the APF is we have kind of a dual mission here. One is, like I said earlier, is to make sure that, hey, we bring people together and they're able to have an environment where they feel comfortable sharing with each other, sharing of ideas, sharing of culture, sharing of education and training, and they're able to do that with an environment that's relaxing and not awkward. And so we saw that 2 days ago in the icebreaker, and we saw that yesterday when the Kenyans, both the Kenyan military and the U.S. military, were interacting together at the end of the official ceremony. So that's one side of it, is that official piece, and then the other is, of course, the amazing community outreach that we're able to do while we're here as pretty much a cost. It's more bang for your buck. We're coming here to do this APF, but we're also coming here and we're able to interact with these, especially with the youth of Africa and the youth of Kenya. And we've been able to do so many things in Nairobi. We played for probably over 4,000 kids over the course of four days in Nairobi, and getting that positive message to them. And now up here in Laikipia County and Lokusero, to able to do the same thing while these people are getting needed medical outreach, and they can also have a good feeling about America as well. When we arrived here, we're teaming up with the medical outreach. They've been here providing some amazing services for people that have such a hard time getting access to medical care, and they've set up here, and they've been drawing citizens all over the area down here, some walking 2 or 3 hours just to reach this area. And while we're here, we're giving them some entertainment, some good feelings, and hopefully getting them to interact more easily with the Americans.